I hope you enjoyed your lunch. Did you enjoy your lunch? Okay, brilliant. There is no afternoon lull. There will be no nodding, no sleeping, no swaying to the side. If you've got chewing gum, that always helps. If you're not a chewer, if someone notices someone sliding to the side, just gently give them a bit of an elbow. There will be no sleeping, no sleeping. We have some fantastic speakers still yet. And for those of you online, sorry you weren't in the room. I hope you managed to get yourself some sarnie or whatever was in your fridge or in your cupboard or whatever. But we had a modest lunch as public sector. Right, we are going to be celebrating the 50th anniversary of the HPMA. Okay, you can do, oh yeah, clap, let's start again. We are going to be celebrating the 50th anniversary of the HPMA. Woo! Absolutely. Some of you were still in your nappies when the HPMA, including myself, I'm giving my age away now, drat, when the HPMA was born. But we have a great panel who are full of insights, and I'm going to hand over to Rachel to take us through. She wants to get the microphone from me. I might have some secrets about Rachel.
Hello everyone, and hello everyone online. My name's Rachel Tyler. I'm the Development Director for the HPMA London Academy. And actually you were expecting Julie Rogers this afternoon, but unfortunately Julie is literally bedbound with a really bad back. She cannot walk, and she's absolutely gutted that she can't be here, because I know she really wanted to come and meet you all, because she's in her 4th month of her appointment as our first full-time Chief Executive, which is really timely, actually, as we celebrate our 50th anniversary. And I'm sure all of you, or a number of you in the room, will have been recipients from the benefit of what the HPMA can offer in terms of your professional development, your career progression, and we'll have a chance to reflect on some of that. But I think really importantly, also think about a vision for the future for us as a profession, and there are a number of issues that came up this morning and questions as well that relate to it. And I'm really delighted that I have Kevin Croft here, who is the Chief People Officer from Imperial, and Kevin has also got a long history with the HPMA. He was the Vice President in London, as I was for 3 years. He was also then became the President, and was also instrumental in setting up the London Academy, for which we're all entirely grateful. So Kevin will have some reflections on that, but also as a really what's the word, inspirational leader. He will also have a lot to say about a vision for the future of the profession. And then I go to my friend Cheryl Samuels. Cheryl is the Director of People and Culture from the Evelina Women and Children's Hospital, part of the GSTT group. And many of you will know Cheryl because she's got such a strong social media profile. And I've had the privilege to work with Cheryl through the HPMA, particularly on the hashtag inclusive HR work, which she will reflect on, but also reflect on her as a people leader and some of her insights. So I've got that awful job of covering someone else's slides. So before I become Julie Rogers, I just want to be Rachel Tyler for a minute, and I want to tell you a story. The reason I'm here is because of this hospital. My father trained as a doctor here and my mother as a nurse in her late teens. So they met here and they've both passed away now. And I do feel that their spirits are always in this historic room with me. And I look up at that matron or whatever she is and think that's probably the kind of person that my mum worked with. So fast forward to, this was at the beginning of the 60s, fast forward to 1988, I'm fresh out of university, and I see a job for a personnel officer at Wembley Community Hospital. And I think personnel, people, NHS, that's what I've been brought up with. I thought, oh, I'll apply for that. And before I went to the interview, I said to my mum, what does personnel do in your hospital? She's a palliative care nurse by then. And she said, oh, I don't know, darling, I think they sign the death certificate. So I went to the interview, still not really knowing what personnel was. And Mike Martin, who's now also deceased, sadly, interviewed me and smoked throughout the whole of his interview how things have changed, and said to me, at any point I'm going to have to stop because the porters are about to go out on strike. And this was me without any experience, and I got the job. So 36 years later, I stand before you having had a fabulous career in HR in the NHS, and I think that as many of us have, and I think that the reason I tell you that story, ultimately it's about our values, isn't it? It's about being a public servant, it's about the patient, and I think that's what retains us and sustains us, really importantly. And I guess this is where we come to the HPMA. Having worked, as I say, for the HPMA now for about 11 years, I think the development, essentially we're here to support you to achieve your potential and hopefully achieve the next stage in your career progression. And a number of you will have done that in part as a result of the aspirant programmes that the HPMA has put on. And I think that we have a really proud heritage in the HPMA. So I'm just going to now become Julie Rogers for a minute, and just Julie wanted to give you an overview of what she's found over the last 4 months. And I think what she's found is an organisation that should be really proud of its heritage. But also there are things that we need to work on. And she's very open about that and very ambitious. I think there's huge potential for the HPMA, and I know that Kevin and Cheryl will also talk to that. So, it's not moving on. There it is. So I don't know about you, I've been to a number of conferences in the earlier stage of my career, and I'd see people turn up with these t-shirts with pink writing on saying HPMA. I think, goodness, what on earth is that? And it took me years to really truly understand what the HPMA is. So just as a bit of background information about the HPMA, we cover the 4 nations. The Healthcare People Management Association is what we're called, and interestingly, the actual constitution of a charity, and we became a charity about six years ago, is that we provide development for people managers in the NHS. I mean, if you think about the scope of that, it's huge, and our focus, as all of you know, has been on the HR and OD profession to date, but I guess that's an interesting thought in terms of the future, because goodness, we all know the level of development our people managers need. So across the 4 nations there are 11 branches. Each of those branches has a vice president. We have 8 trustees. We also have, I think about 85% of NHS HR staff or organisations are members of the HPMA. So you'd think, why wouldn't an organisation want to be a member of the HPMA? And I think that's where Julie will be coming from in terms of really ensuring that we have a fantastic offer so that all NHS trusts will want to become members. And I guess I've got 2 hats on, because we're so lucky here in London and South East and South Central, because we do have the London Academy. There's one other academy that's just been set up in the north. It's not yet at the stage of delivering the extent of the programme that we deliver. So one of my pleas is always to ensure that you do everything you can to ensure you take up the opportunities that we have to offer for you and your teams, because we see real variety in terms of the take-up across organisations, and sometimes when a CPO leaves, it either goes down or goes up, and it's an indication, isn't it, of their commitment to the development of their teams. So really, really crucial to ensure that you do this. And I guess as I'm talking, I also invite you to really think about your own development. Are you taking control of your own development? Are you in a kind of slightly stagnant phase, or are you in a in a really enriched, energised phase, because we all go through those stages, don't we, throughout our career, and it's often that development programme or that project that stretches us, that actually enriches us and thinks, and we stay, hopefully stay in the NHS, or we get that next role as a result of the stretch that we've had. So that's some information about the HPMA. Oh, wrong way. So as I say, Julie's been going up and down the country. There's a lot of really strong feedback, positive feedback, but the things that she is hearing is that we really need to improve our transparency around our decision making. We also need to look at the equity of the offer across the country, because some branches are a lot more active than others in terms of provision of development events. And as I say, we're fortunate that some parts of the country are yet to receive the sort of level of number of events that they should. So that's an issue. So just a bit about the strategy. Julie's really glad that we've just got 1 year to go of our current strategy, and I think we've all looked at it and agree that it needs a real refresh, a revamp. There are actually 6 values that spell out people. I didn't actually realise it spelled out people. Did you know that? And I think that you should really have about 3 values, so we need to review the values. And then the 5 objectives we think are more action-based, and we need to be really visionary and ambitious in terms of the objectives that we wish to pursue, with really clear deliverables and success criteria, etc. So our goal, I can't quite read that, our goal that we're anticipating based on the feedback is to be recognised as an ambitious and sustainable member-led organisation supporting a thriving professional community, influencing national policy, professional development across the 4 nations. So that's our goal, and we will be consulting with all of you as members to ensure that we achieve that goal. And those are just some of the thoughts around the delivery model. Have any of you won awards, HPMA awards? Gareth, you did, yeah. Tanya Marie. So this is about all the different aspects of the offer that the HPMA, and as I say, Julie's working now with the branches to really shore up that offer, improve that offer. So thank you from Julie. I hope I've given her slides enough credence and credit. I'm going to now talk to Kevin and Cheryl about, first of all, about the HPMA, their vision for the future, the potential for the HPMA, but also for us as a profession. So, and I've also got some specific questions, and I really would love you, if you have questions for Kevin and Cheryl here and online, because we've got this opportunity. Okay, Kevin, do you want to start off?
Yeah, so as Rachel mentioned, I've sort of worked with the HPMA for a while. First of all, in 2007, 8 probably, and I think if we want to talk about where next, I feel there's parallels now with where we were back in 2007, 8. And what was happening there? We had a national HR director appointed from outside the NHS, from Tesco's, I think Claire was. I can't remember her second name, Terry probably will. And she wanted to develop an HR academy nationally. And because I was then the chair of the London Healthcare People Management Association branch and the vice president, I got involved in some of the national discussions about creating an HR academy for the country, which is very exciting. It was a great vision, but it was all just too big, and it just didn't get off the ground. And what we decided to do in London was to try and engage the HR directors to see, well, can we create an HR academy in London? And I used to go to loads of meetings, some of them in this room actually, with HR directors, and everybody was supportive of the idea, but it was how do you sort of pull it off. And eventually, somebody from the regional office just said, look, can you just give him some money to get him out of our hair really. And so Diana's not here today, I haven't seen her, but if you've ever, if you don't know Diana Cliff, you probably haven't been engaged in HPMA in London. She's very much a behind the scenes person, so even if she was here, she probably wouldn't let me get her on the stage. But she was coming back from secondment from NHS employers. I got a phone call from the regional office and said, look, Diana's coming back, do you want to have her to start that academy thing that you keep going on about? And I think the thing is that it was ages before anybody sort of was able to turn a great idea into something that was sort of doable. And that was, I think that we started the academy in 2009. So it's, I think officially on the paperwork today it says 10, but I was the chair of the London branch. And also some parallels is all we did really, so it was the London branch of the Healthcare People Management Association. And being a branch chair felt, I was showing my age now, but it felt almost like something from the sort of wheel tappers and shunters club. It's like a sort of a thing that was just sort of very dull and boring. And all we did was change the last letter from association to academy, and we had some really great support from some of the companies as well that I can see in the room from the bags and everything they're giving out. So we had a great idea, we had support, we had somebody to help make it happen, which was Diana, and we had resources because of some of the suppliers. And so I think that's how it's really gone from strength to strength, and I think that it's still seen across the country from an HPMA perspective as the sort of the jewel in the crown of the HPMA. And when I took over as president, I tried to sort of do an Apple and everybody will have a computer in every town. And so that we, at that point, I used to describe the HPMA council meetings as that scene in The Wizard of Oz where Nancy, the Tin Man and the Lion, they get to Oz. There's a big booming voice and the little dog pulls back a curtain and it's a little man with a big voice. And in those days, when I went to the HPMA council, I got my best suit on and thought, right, this is a really important meeting. There was 5 of us in a room, I think it was in Guy's, not St Thomas's. And Northern Ireland phoned in, Wales phoned in, on one of those spider phones that they used to have. There was me from London, there was somebody from Birmingham, and the rest were staff supporting. And so it was really quite small, even though it had a good brand. And so we tried then to create academies in each of the regions, so it's great to see some of that happening. But where I wanted to sort of draw parallels is that we've got a professional development board. I don't know whether people are aware of that, but as part of the HR Futures, there is a professional development board that is overseeing the development of the profession. And the bit that I really think where there's an opportunity here, and I almost want to test out whether you think it's a good idea. If you think about the medical profession and their development and their education, and the link between research, education and practice, that is really tightly connected. And one of the things that I think we need to think about as a profession is how can we connect better with research and education. And we've been having some conversations nationally, this is the parallel. At the Professional Development Board, we've been having some conversations about how we get more into primary research, how we link with education, and it's all a bit too big. Pav's there, don't tell tales going back to the office. And the Shelford Group were really interested in some of this stuff, but I think we've got an opportunity to do something in London about bringing practice, education and research together. As part of the HR Futures report, it mentions about doing more primary research, and the National Institute of Healthcare Research are really interested in workforce as a main sort of, and they've been giving out money recently for that. And so I think that what we should be looking to do is to link with those education providers in London particularly those that are doing masters in HR, who also have the academics that will be interested, and that we should try and connect the practitioners with the researchers and the educators, and create our own version of the medical sort of system. We won't have the resource and we won't have that infrastructure, but that's what I'd like to see, is that it's almost like academy and beyond, is how can we link with the researchers and the educationists, so that the research that is done is what we want as practitioners, and that we influence the education that's given. And so I suppose I'd be interested to know whether people think that is something they'd be interested in.
Any immediate points of feedback from the room? Does it sound like something colleagues would be interested in?
Kevin knows I've always got an opinion on this. I'm Laura Brown from Chelsea and Hillingdon. Completely agree. I've really tried to take an evidence-based approach and have been trying to encourage the teams to do more so. About 3 years ago, I tried to partner with an academic institution to do some primary research within Chelsea. It was incredibly difficult because all of the research processes were set up for clinical as opposed to workforce. So I'm fully supportive of this, and how do we overcome that barrier, because there's so many queries and questions that it doesn't matter about bloods, we're not interested in those kind of things, but I just really struggle to get that through. So yes, fully supportive, anything I can do to help.
I can see some other nodding heads around
I think
the room.
what I've found out in trying to do some of this stuff is that the research is very driven by the grants and the money, and academics are interested in their academic areas. So we almost have to understand what are the funding streams that supports the research, and that's why it's important that we influence the commissioning of the research through the NIHR. And then I think if you try and convince an academic to do work on your things that are not their interest and what they research, it's almost like asking somebody to change their career. And so I think that we have to start where we can see the relationships and the benefits together.
I think anyone that's interested should contact Kevin directly to start with and add their ideas, because Kevin is someone that makes things happen. So yeah, do that. I'm going to turn to Cheryl now and ask you what you feel, what initiative have you worked in over the course of your career that you think's had the greatest impact?
So I think that as we were approaching the pandemic, it became even more obvious to me just how much pressure our HR professionals were under, recognising just how difficult the situations and the circumstances were, but also starting to really see the gaps in knowledge, experience, and seeing how the lack of diversity within our profession is actually influencing our practice, and the things that we were actually really trying to improve. And so I think #InclusiveHR was born as a result of me and Rachel recognising that inequality within the profession, but also feeling like actually we've really got to start to really hold the mirror up, be really clear about exactly where we are as individuals, what are we doing in terms of our own practice, what steps are we taking to actually really get underneath the skin and actually really understand what are the inequalities that we actually really need to try and close the gap on, and how can we do that. And so #InclusiveHR has been one of the things. There's lots of things I can say that I'm proud of within my career as a HR practitioner and leader, but I think this is the legacy thing that I would like to leave with the profession. If I die tomorrow, I really want people to actually really take it on board and really start to drive it and make the difference. And I'd like to know through my spirits that live on, that essentially that we're actually going to be a much more diverse, more socially conscious profession that is actually really driving and positively disrupting all the norms that actually at the moment we kind of keep perpetuating the status quo, and it's time for change, and we've kind of got to do that now. So the 5-step challenge to change that I devised, it's now wonderful to see that that's now out in 70 plus trusts across the country that are all doing it to one degree or another, and actually starting to see some of the benefits that have been reaped from that.
Thank you. Are there any questions for Cheryl? Okay, do you want to?
I'm going to summarise this question because it was a long one. Many of the HR teams work in siloed transactional roles. Does the panel think that investing in team development through CPD, apprenticeships and short courses with on-site experience and cross-departmental shadowing would create a more well-rounded HR profession who values teams and understands all functions? Would it work?
Cheryl?
Well, I think the first thing is I'm always amazed when I meet people and I ask them about the HPMA, and actually we've still got HR professionals that are joining our services, our directorates, our organisations, and still don't know who HPMA are. There's something that everyone can take away as an action around actually making sure as part of the induction for everybody that's inducted into our HR and OD departments that actually they all know who the HPMA are, they know whether or not they're a member or not, and also that they're empowered to actually access the training and development that's actually available and open to them. So any organisation that I join and I have a team, even if you go and speak to people that are part of my team, they will tell you I actively encourage them to go and find out what courses and things are available, what learning opportunities are. And also just remember, not everything is about courses and formal learning. Some of this is about the networks you develop, the connections you make, thinking about people that will stretch your thoughts and opinions, but also being able to diversify your sphere of influence. And actually, where do you take your insights from? Do you take them from people that are similar to you, or do you take them from people that are different to you? And what do you do to actually really push the boundaries, to actually really try and find out what other people think and how they see the world? And how does that then influence your practice? So I think there's something about people taking responsibility and ownership for their own learning and development, and not waiting for leaders or others to actually really tell them to. You need to own that. And I think that the other bit to all of that is not only taking responsibility, but if you are leaders, you should be actively encouraging your staff to actually engage in this. I look at the finance profession, and the HFMA is the equivalent of the HPMA. They've got a really structured programme. They actively encourage their staff to go on aspirant programmes, and they put them in touch or give them projects to do. They'll give them exposure to particular things. Actually, if we all want to progress, or we actually just want to broaden the breadth of our knowledge, skills and portfolios, actually sometimes that means actually putting yourself up there and making yourself known that you actually want to do some of that. So I'd really encourage people to feel empowered to actually take control of their own destiny and kind of drive where it is that you want to go, and not be passive in that space. You can be in the front seat in terms of driving that.
I think there was a question, Dan. Do you want... Allow me to my watch just stopped.
Hi. I think this is a question for Cheryl. How can you positively disrupt some of the... I'm trying to be politically correct about this, but how can you positively disrupt some of the indignities, I'm going to call them indignities because they are, that come out of C-suite professionals not necessarily understanding the importance of equality and representation in HR people functions? How can you positively disrupt conversations that don't necessarily reflect the direction that we need to go to, because the lived experiences of the people in C-suite do not reflect the people, the majority of the people in their workforce. How do you have conversations about the knowledge of those professionals in those higher positions who they don't, you ask them a question, what does equity mean? And you don't get answers reflective of their level of seniority. So how do you have those conversations without alienating people and, you know, positively moving the conversation forward?
So I would say that one of the things that you can do is, or one of the things that you must do, and some of this is about psychological safety, it's about actually being safe. I mean, I quite often have put my head above the parapet, but I try not to do that in isolation. So it's really important to find out, where are your allies in this space? They might not look like you, but there are people that will hold very similar views and will want to drive through some of the things that we would want to positively disrupt. There are some people who are actively trying to find out, or on their journeys. There are others who actually are oblivious to it all. And I think that in order to make the change, you have to find who those allies are. And I'd also say there's something about, you know, people with whichever protected characteristic it is, or multiple, because it's intersectional. Don't make assumptions also that because someone's different to you, that they might not be having some of those difficult conversations, because there are some things that you can say and there are some things that other people can say that and they'll hear it. And if you think about it, that's even the sort of thing you have in your own sort of family dynamics. There's things that I have two sisters, and so one's nearly 40 and the other one's 23. And actually sometimes Crystal has to say things to Talia because she'll take it from her, but she won't take it from me because I'm seen as old. So she's just not going to hear. So you don't really understand. So, but she'll take it from someone else. And it's the same in the workplace. You'll have people that will take things from certain other people. And I think there's something about the credibility and the ability to influence. And it's recognising when it's appropriate for different people to intervene in different spaces.
Great. Thank you. An awful lot in there, very rich response. I'm being told I've got to wrap up now. My watch stopping in the middle. Thank you so much for listening to us and for celebrating the 50th anniversary of the HPMA. I think we're all very proud of the work that collectively we've led, and I think there's an awful lot of potential going forward, and just make the most of the HPMA and the London Academy and all those opportunities for you and your teams. So thank you very much.